Hello, welcome. This is Dr. Popovitz. Today we're coming to you from the New York Bone and Joint Specialist's brand new Midtown Manhattan location at 425 Madison Avenue. We're very happy to be here and we're really excited to serve our community. Today I'm going to talk to you about how to keep your joints healthy for the next 100 years. Forever I've been talking about how preservation is the key to longevity. The longer you live, the happier you are. Everybody wants to live longer, but how do you do it? We all are born with everything that we need to preserve our health for decades and decades and decades. The key is to preserve what we've been born with. And this holds true for all types of medicine, but in particular orthopedics, bone and joint medicine. It's very, very important to preserve all our cartilage and bone structure so that we can feel functional and happy and alive as we progress in our age. Ultimately, the old saying is that you are as old as you feel. So if you feel mobile, if you feel strong, if you can walk 2 miles a day, then you're going to feel far younger than whatever age you might be. So what are the keys to preserving our bone and joint health for the next 100 years? The first thing is move. Get up, get out of the chair, move, move, move. So many people are just sitting and sitting and sitting, particularly with work. In particular, it's important to get up, if you can, every half hour or so. That would be very, very valuable. In fact, it's been shown, studies have been shown, that the more we move, the more nutrition flows to our cartilage. And we actually do procedures on cartilage in the joints, and then after the surgery, some of the typical treatment, rehabilitation is movement, passive movement. And that in of itself gets all the nutritious fluid going to the cartilage and allowing it to heal. So movement in of itself is a preventative measure and a treatment in of itself, particularly for our cartilage. Next is exercise. I typically recommend low impact exercise. Theoretically, if you have no pre-existing conditions, if you have no issues with your joints, then you can go out there and hit it hard on the treadmill, on the street, wherever you want. But if you have any particular pre-existing conditions, I would stick with low impact. But quite frankly, I prefer low impact in general. To be specific, I would start with core exercises. It's very, very important to maintain the strength of your core so that your body structure holds up your body well. And I would make sure to do some light to moderate weight training. You don't have to go crazy. You don't have to bench press 1,000 pounds. Light weights with high repetition is more than enough just to maintain the muscle strength and function. And again, walk, walk, walk. You don't have to run if you don't want to, but if you run, that's great too. It has been shown that if you already have a pre-existing condition, you do a lot of running on, say, on your joints or your hips, it may accelerate or progress that condition. So if you don't, you can run all you want, but in general, walking in of itself is the most ideal exercise. The more you walk, the better it is for your body. Then you can do exercise-specific exercises. For example, if you are concerned about your knees, you want to focus on quad strengthening exercises and stretches for your IT band and hamstrings. If you're concerned about your shoulder, you want to work on rotator cuff exercises to strengthen your rotator cuff and stretch your capsules, the structures in front and the back of your shoulder. But that is only specific per joint, and we can talk about specific exercises per joint at a later time. Next, it's really important to keep that inflammation in your body as low as possible. Simplest things you can do is avoid foods that increase the inflammation. So So avoid seed oils, avoid sugar, avoid refined carbohydrates, avoid processed foods such as processed meats. All those things really elevate your inflammation, and that affects your entire body, let alone the cartilage in your joints. You should eat foods that are good in lowering the inflammation in your body, such as fatty fish with omega-3 such as salmon or sardines. Avocado is a very, very healthy fat. Berries, outstanding antioxidant. Nuts, chia seeds, leafy greens, and turmeric are all very, very helpful things that you can add to your diet that could lower and keep that inflammation under control. Supplements are actually a very, very important part of many people's lives, and it's become more and more in vogue. Everybody has different opinions on which supplements to use. I'm a big advocate of vitamin D. That in of itself has been shown an enormous amount of benefits to overall health and prevention of diseases. But in particular, for the bones and joints, it helps maintain the muscle mass. It helps has a lot of benefit towards bone strength. It has often been advised to use K2 vitamin in conjunction with D3 because they have a symbiotic relationship, and both working together will help maintain that bone strength. K2 has other benefits such as clotting, but in particular for the bones, it's very, very helpful. Omega-3 fish oils are very, very important. For overall health, for your heart health and energy, but it's particularly helpful to minimize the inflammation in our body. Glucosamine and chondroitin. This is a supplement that's been really around for a good couple of decades now, and the studies are more and more evident to show that it decreases any kind of joint pain. So if you don't have any joint issues, you don't necessarily have to take the glucosamine. A lot of people do just as a preventative measure, but if you already do, glucosamine and chondroitin supplements are very, very helpful. It has been shown that you have to take it for at least 6 weeks before you see significant benefits, and you have to check to see if you have any high blood sugars. If you have a history of diabetes, then you should be cautious of glucosamine because it may elevate your sugars. But otherwise, it's a very, very helpful supplement to decrease pain related to joints. Turmeric, it's been naturally available for centuries. A lot of people use it in different cultures, in addition to their foods. And it's available as a supplement, which makes it very, very easy. And it's a very, very powerful anti-inflammatory. If you have any bleeding disorders, do be cautious because it may affect that. But if you don't, and you have joint pain and issues, turmeric is a wonderful supplement, and also has a lot of other health benefits for your overall health and well-being. Lastly, collagen. Collagen is an important structure to the matrix of the soft tissue structures in our body, and it's a very, very important product in our body for health. And lately, there's been more and more studies to show that it really helps in joint recovery. So if you're very active and you do a lot of exercise, or you're just functioning a lot, you're doing a lot, you're running around a lot, which you should, collagen supplements are very, very helpful for you to recover and maintain the strength of your joints and muscles. It's really essential. And as we're getting more and more information these days from social media and so many different kind of directions, it's really important to incorporate standard steps in your life that will promote your health. And it's really important to be proactive about it. It's clear that it's no longer of any benefit just to kind of go through the motions. You really have to kind of set a plan, set down what you're going to do each day, what you're going to take each day, what you're going to eat each day, what you're going to avoid each day. And that will guide you to a better health, better life, and God be willing, healthy joints and bones for the next 100 years. I'm Dr. Popovitz. Thank you so much for joining me. Oh, and please be sure to like this video and subscribe to our channel. All the best.